And here to tell us more about the condition is Dr. Derek Hoyme, a pediatric cardiologist at American Family Children's Hospital in Madison.
Nice to see you.
Thanks for being with us today.
Thanks for having me.
So how common is this particular condition that Jimmy Kimmel's son had?
So the condition that his son has is called tetralogy of Fallot. It's the most common cyanotic congenital heart disease that kids can have, but still it's relatively rare. It's only 5 cases per 10,000 births.
Well, did you watch Jimmy Kimmel? Were you watching by any chance that night?
I did.
You were watching.
Yes.
So what was your reaction to that? A lot more people know about it now. That's the good thing about it.
I agree. I applaud his bravery for sharing the story, and you know, his story is actually quite common for the families that we take care of.
So how do you, what are the symptoms? What would a doctor or a parent look for?
So usually when we're observing the children in the hospital, sometimes, like he said, the baby can have kind of a purple or a blue color to them. But oftentimes we don't really see that color very well. So actually we've introduced a screening process for babies before they go home from the hospital where we check the oxygen saturations non-invasively to make sure that they're high enough.
So this is something that all newborns get when they're born, because well, they don't have an OB unit at American Family Children's Hospital. So how do you get this checked? Do you have to take your doctor to the hospital?
No, actually, the physicians at Meriter Hospital, where we deliver the babies, as well as St. Mary's Hospital, are all trained to do this screening procedure. And basically, it's measuring an oxygen saturation in the right upper extremity and then the lower extremities to make sure that the oxygen saturations are high enough to go home.
And if untreated?
If untreated, tetralogy of Fallot can be fatal. However, usually, you know, we're catching the majority of cases now, and with surgery, children do very, very well. Greater than 95% will survive to hospital discharge if they're repaired by 6 months of age.
Does it always require surgery?
Yes, it does.
It does.
Yes.
And as children age, then, do they just develop normally once it's repaired?
Yeah, usually. If we catch it early on and the children are repaired early, they develop very, very well and live normal lives.
So Jimmy Kimmel raised awareness about that and all possible birth defects. I mean, I would assume cardiologists applaud the effort.
Absolutely. You know, anything that draws attention to the patients that we take care of, the families that care for these children, is something that everybody needs to be aware of.
Yeah, it's the power of celebrity. It's similar to David Letterman when he had his heart procedure. It just raises a lot of awareness about it.
Exactly.
And do you see a lot of this in your practice?
Yes, we do. At American Family Children's Hospital, we take care of the gamut of congenital heart disease, and we do see a fair number of patients with tetralogy of Fallot, and our care team over there is very, very good at taking care of these patients.
Rewarding work indeed.
Yep.
Doctor, thanks for being with us today.
Thanks so much.
Great to see you.
Nice to see you.